FDA is warning women that they are seeing more cases of a very rare cancer that is linked to breast implants. Dr. Richard Chaffoo joins us with more. Dr. Chaffoo, I know there's quite a few women who have had these breast augmentation and these implants. So this, should this be even something that they're concerned about right now?
Well, the truth is that there are very few cases, Shally, in the world literature. There's, just a few hundred cases of this in terms of relation to the implant. It's important for people to know it's not primary breast cancer.
Okay.
It's actually a lymphoma that's associated with the capsule of the implant. And in these cases that they've seen, it's been seen in primarily implants that have got a rough surface are called textured implants. That's only about 13% of implants that are put in within the United States. And it's also important to notice that there are about 500,000 implants in the U.S. that are put in each year. And this disease is represented, thought to be between 1 in 3,000 and 1 in 30,000 incidents.
Okay.
So it's a very small percentage of women.
You brought a few examples. If I may, can I
Sure,
feel so I can see what you're talking about?
So this is kind of the gummy bear or a breast implant. These are the smooth implants. So the surface is smooth versus the ones where they've demonstrated this disease has been within the implants that have got a rough surface or a textured surface. The theory being that there's some irritation that may occur along the surface of the implant with the body, and when everybody forms a capsule around an implant, and there's fluid that's actually created and developed. And so women typically will have had their implants put in, Shally, many years ago, and then they'll present with swelling, unilateral swelling to that breast and go in and see their plastic surgeon.
So is this because of implants, like older? Is this the textured thing? Is that like an older style, the newer styles?
Well, it's a delay in diagnosis. So most implants that are put in are smooth. A small percentage have a rough or a textured surface.
Why would a doctor want to put in, or a patient?
It may be just physician preference. I've always tended to use a smooth implant because one, they're less expensive, and two, I think they have a lower complication rate.
But when you say it's a preference, do the textured ones do something different?
Well, so the data is, if you're putting an implant above the muscle, which most plastic surgeons do not do, there's studies that seem to indicate that a textured implant has less likelihood to form a hard capsule called capsular contracture. But if the implant's put beneath the muscle, which most of us do, then that's not a factor anymore.
So let's say you're someone who is watching right now and maybe you have one of these implants that you're referring to. Is this concerning enough that you want to call a doctor and have them removed?
Well, no, certainly not. I think the important thing that I tell my patients and plastic surgeons tell them that once we've put an implant in a patient, we see them on a year basis. So if you're concerned, if you have some unilateral swelling, then certainly that's a concern. The important take-home message is that 93% of women that actually developed this disease were disease-free at 3 years. It's actually a very localized disease if caught early. And so if you want information, we have a website, the American Society of Plastic Surgeons. If they go to www.plasticsurgery.org, there is a lot of excellent information about the FDA studies and information about patient registry and just data to explain to people what's going on.
And you would have a symptom, correct?
You would have unilateral swelling, sometimes irritation, so you would not be completely asymptomatic.
Dr. Chaffoo, thank you for being here. That's important stuff.
Good to see it is.
All right.
Yes.